Icy Tales, we are in conversation with people whom we call as noble human beings. Today I'm in conversation with a doctor, Dr. Anand. So, welcome, sir. How is your day and how does it feel to be here?
Yeah, thank you, Hiba. I'm very happy and thanks for inviting me for this interview. And I'm fine. How are you?
I'm doing great, sir. Thank you so much for asking.
Good, good. Thank you.
Right. So, without holding up further, I think we should get started because below we have so many good discussions to happen. So, can we get started?
Yeah, please go ahead.
So, let's begin with the basic root of all questions. Tell us something about yourself and your journey with Dr. Hedgewar Hospital.
Yeah, my name is Dr. Anant Pandhare.
Mm-hmm.
I'm medical director of Dr. Hedgewar Hospital, which is
Okay.
in Aurangabad.
Mm-hmm.
And I started my career with this organization, and I'm sure my career will end with this organization. So most of my colleagues also have the same lifetime commitment to this work.
Mm-hmm.
So those they have formed this organization, they are after 33 years, they're still with us
Oh.
and they're working relentlessly.
Mm-hmm.
Basic idea of Dr. Hedgewar Hospital is to give maximum to the society and to accept a minimum from the society,
Mm-hmm.
in spite of being doctors. So
Mm-hmm.
what we have done is we are all specialists, super specialists,
Okay.
and we in Aurangabad are creating a model of health service wherein a doctor can serve a patient and accept minimum possible remuneration what is required for him and and reach out to maximum number of patients. So
Okay.
I'm very proud to say that we have 80 doctors who work on a subsistence salary,
Mm-hmm.
minimum possible salary, and they live a modest middle class life,
Mm-hmm.
but they are experts in their own fields. Somebody is an orthopedic surgeon doing almost every day total knee replacement. Someone is a cardiologist doing angioplasty 3 in a day, but they are happy on a small salary.
Mm-hmm.
And because of that, this group has created a wonderful, low cost, high quality, affordable solution in healthcare,
Mm-hmm.
which is called as today Dr. Hedgewar Hospital. We have treated more than, I would say, 7.5 million patients till date. Yeah. And it's one of the best hospital in the country today, but very cheap, very ethical, and very honest
Mm-hmm.
hospital. We have done a lot of new things in this hospital. So, and the second part of this hospital is that this hospital is a source of energy or catalyst in social development
Mm-hmm.
in rural and slum areas.
Mm-hmm.
So community health projects and variety of developmental projects are going on. So I am part of the very good team of doctors who
Mm-hmm.
are full-time working in this organization.
It's very, very
So
nice
that's
to
about me.
Yeah, very, very nice to know
Yeah.
because I think we really need people like this to make this world a better place. So I'm glad that you and your
Thank
team
you.
are working for a good cause. So great job on that. Also, when I was
Thank you.
researching, I noticed that you're a part of this organization called BAVP, which is Dr. Baba Saheb Ambedkar Vaidyakiya Pratishthan. So can you tell us something about it and what does the work revolve around?
All right. BAVP is a parent trust of all these hospitals.
Okay.
Hedgewar Hospital is the flagship activity of BAVP. And the second hospital which BAVP formed is in Nashik, which is
Mm-hmm.
also doing exemplary work last since 2008. There are also a bunch of good doctors and specialists. They have come together
Mm-hmm.
and they are providing very high quality, affordable treatment to people of Nashik.
Okay.
And we have a world class blood bank, which is one
Mm-hmm.
of the best in Asia in Aurangabad. We are setting up a big PPP project with the help of ONGC
Mm-hmm.
in Assam, in the upper Assam area that is called as Shivsagar,
Mm-hmm.
where a 300 bed is coming up, a 300 bed hospital is coming up, and which will be inaugurated in January, most probably at the hands of Honorable Prime Minister.
Mm-hmm.
So BAVP is basically a social change organization, we can say,
Mm-hmm.
that whatever and wherever it is possible to change the life of people, BAVP is very keen on starting that project. So
Okay.
we started hospital, we started blood bank, but we also started a skill development project for rural poor girls
Oh.
or adolescent health project for 10,000 adolescent girls in slums and rural areas, or literacy classes for illiterate slum women, or catering courses for poor slum girls. So all these projects took birth out of need of the society and with the will to do something good for the society. So BAVP is spreading its projects and wings in various sectors. Very soon we will enter into medical education. We are already running a nursing college, but now in 2024 we'll start a big medical college in Aurangabad. That's what BAVP is about.
Very nice to see that work again, and all the very best for the hospital which is going to be launched. We hope that it's a grand success.
Thank you.
Also, sir, I was
Thank you.
seeing this case study which was very, very significant. Before we get into that, just for our audience to get a gist of it, can you tell us what exactly is swap transplant treatment of kidneys?
Yeah. As the word says, swap transplant means somebody's kidney to somebody and somebody's kidney to somebody in a very simplified language. But to be precise, swap transplant is suppose a lady is there who needs her kidney is problematic and need to be replaced. And her husband is willing to give her the kidney, but his blood group is B positive. And lady's blood group is A positive. So this A and B is incompatible. They doesn't go with each other.
Right.
And suppose there is another couple which also one of them is needing suppose a kidney and the group is A and B again. So donor of first lady, that is her husband, will donate to the other patient, and donor of that lady with the same blood group of the previous lady will donate to the first lady.
Right.
So it's like a exchange of kidneys, and this is very scientific method. This is legally and technically qualified method. So this also reduces the burden of and waiting time of a patient. So we are always in search of such patients, and if there is a blood group mismatch, we contact them and we request them that whether you are ready to give kidney instead of your husband to this person, and the same another lady will give it to the another person.
Right.
So this is called as swap transplant, which is ABIO compatible transplant, AB blood group compatibility.
So with that being said, let's get to the case. So Mrs. Rajni G. Kale, her case considered to be so significant, and can you tell us something about the case?
Yeah, this particular patient was having a kidney issue, and patient was the recipient, means the person who was needing kidney was having A blood group, and she was a lady, and her husband was having a B blood group. But because A and B blood group, you can donate kidney of a B blood group man to the A blood group wife, but it has three components. One is the cost is very high. There are a lot of tests which are required to be done in this case. Second thing is there is a risk involved of mismatch, that this kidney may get rejected by the patient's body. And third thing is these generally a lot of medicines have to be given to the recipient patient, one who receives B blood group kidney in spite of having A blood group. So he need to be treated very aggressively. All these puts very high cost and very long waiting time for a patient. So in this case, this Rajni Kale case, another couple was waiting for a kidney, matching kidney. So we but that was registered in another hospital. So we contacted that hospital. If you have a blood group kidney, we have a blood group kidney patient, and we have a B group kidney if you have a B group kidney patient. So we swapped this at exactly same time at both the hospitals. The kidney transplant was done with an understanding of patients, and within an hour 2 kidneys were replaced. Both the patients got treated. Both are doing extremely well. Both are thankful to each other
Yes.
because her husband gave it to that patient. So this has saved a lot of time, lot of agony and stress of patients,
Yes.
and it is a scientific method. It was
Correct.
obviously approved by the kidney board.
Mm-hmm.
So it was a very, very talk of the town kind of case because two
Mm-hmm.
kidneys swapped at a time.
And it's very good also because two lives are now happy because of each other. So
Exactly. Exactly.
very nice story of this entire transplant. Moving on to the next question. Since you are a doctor, what is your opinion about chronic illnesses because of our lifestyle choices today?
Yeah, it's very unfortunate and it's very relevant question at this case study is that because of the current lifestyle,
Mm-hmm.
sometimes sedentary, sometimes stressful, everybody is running whole day. So people are alive and joyful only on Sundays.
Right.
That's if I say that, it's not a exaggeration because otherwise they are continuously moving around either in traffic or in office or somewhere.
Mm-hmm.
So because of that, there is a increasing incidence of hypertension and diabetes.
Yes.
And this outside food eating adds to this.
Mm-hmm.
And hypertension and diabetes are such a diseases which affect every part of the body.
Yes.
You take eyes, you take ear, you take heart, you take vessels, weight, everything, neurological system, everything is affected by hypertension and diabetes.
Mm-hmm.
So because of the increase in the incidence of these two diseases, there
Mm-hmm.
is increasing incidence of kidney diseases. Chronic kidney diseases are on the rise.
Yes.
And that has made kidney transplant a big necessity or a dialysis as a major necessity.
Mm-hmm.
That's why you must have seen everywhere there are charitable organizations putting up dialysis units everywhere
Yes.
because the number is increasing. And when I'm saying this, this is not just related to only affluent or upper middle class people.
Mm-hmm.
It is also prevalent more in the lower income group also.
Yes.
And the reasons are stress and poverty, other reasons are there.
Mm-hmm.
So the only solution to this is
Mm-hmm.
to have a stress-free life, doing some basic exercise on a very routine basis, and managing your diet very well. So these are the three mantras which will definitely uh, prevent these diseases and falling prey to the kidney transplant kind of thing.
Yes. And more
So
than
it's
just
very relevant question.
kidneys,
Yeah,
I feel like generally itself, having a good lifestyle is very important. So I'm sure whatever
very
tips you
true.
gave will help our audience. So thank you so much for that, sir. And apart
Thank
from this
you.
case, what would you want to say about organ donation, and how would you like to raise awareness on that?
Yeah. See, our human body is a fantastic design, and
Mm.
it's a uniquely manufactured thing.
Yes.
Not nobody can even imagine of that. So there are many organs in the body, and the first and foremost organ in which we have been working is blood as an organ.
Mm-hmm.
So we give the blood donation, and the blood get replenished.
Yes.
So we have been into blood donation since long. But as far as organ donation is concerned, their kidney, liver, cornea, variety of organs can be donated. And now everybody knows that uh, if he decides to donate organ after his death, or sometimes kidney can be donated even during this. So this is saves the life of a patient on a very noble path.
Right.
So so this awareness about that you can live even after death. So that awareness need to be done amongst various sectors of society. And
Yes.
the first and foremost awareness needs to be done amongst the medical practitioners.
Mm-hmm.
Medical practitioners should constantly speak to their patient, their relatives about organ donation. There should be leaflets, brochures, displays can be done in every clinic, every private clinic, so that every patient coming to them realizes that this is a way of serving the society. That's one thing. Another, community awareness is required in various groups also.
Mm-hmm.
Like you will find that there are Rotary clubs, there are Lions club, Giants clubs, then there are Mahila mandals. and a lot of other religious groups, they come together for various reasons. If an awareness campaign can be done in that, and I'm sure a lot of people are doing also, but it needs to be increased. So that's another platform where we can do this. Another third thing which is picking up the speed is that the cadaveric transplant means if a patient dies suddenly, a person dies suddenly for some reason, maybe accident or whatever. So if a medical doctor who comes across such patients and he can't save it, if he convinces their relatives that now that your son or a father or a mother has died and we could not save it, but if organs can be donated, there are 3-4 lives we can save.
Yes.
And I would like to quote an example in my hospital. One of our male nurse, he suffered from some disease, and within 6 months' time, he realized that he will not survive. So before death, he convinced my doctor that he wants to donate all his possible organs to some patients, and he convinced his parents also. So he died in our own hospital, and his all 4 organs were 2 kidneys, liver, and 2 corneas were donated, and it was immediately transferred to Mumbai even and to Aurangabad, other patients, and we could save 5 such. We could donate to 5 patients at a time. So one single man has made such a difference. So this awareness needs to be generated amongst patients. And one more thing is that there are certain legislations and rules government also need to pass on, and pass on some incentives if a patient or a person agrees to donate his organs posthumously also, then some benefits or some legislation is passed on. Government also can contribute in this process. So this is something variety of people can do in various sectors of society, and the organ donation can take literally a good speed, and a lot of lives can be saved.
And I hope that it does take a good speed and many people get their lives saved.
It will. I'm very confident it will take up. Yeah. Because we see a lot of patients moving around with a donated organs. They are living a normal life.
Yes.
And that makes a lot of difference.
I really like your confidence on that part, sir, and I really hope that this does get successful and does happen in the future. So great job on that.
Thank you.
And let's go on to our last question, which is something that I think none of us like, which is the pandemic. So I'm sure as a doctor, you would have faced so many, issues during the pandemic. So how did you fight these challenges that came your way during the pandemic?
Yeah, it was actually a pandemic which has taught us a lot of things in life. And we being a big hospital in Marathwada, we were at the forefront of dealing with this crisis. And initial first wave, everybody was clueless. What is going on? What is the treatment? What exactly is COVID or not? So in a shortest time, see, when it is a confusion and gray area in our science also, it is been told, and it is our parampara also, it is told that a group can resolve such uncertain things.
Yes.
So the first thing Hedgewar Hospital did was to form a group of various practitioners within the hospital, and the COVID task force, we called it. And whenever there is ambiguity, there is no direction in treating a patient, or complications are going on, this group every day used to discuss and do the best possible thing. This has given us a fantastic results as far as saving the patient is concerned. We treated more than 1,000 patients in COVID pandemic, admitted them. And the best part is that the response of the medical team, all medical practitioners, not just doctors, but nursing staff, the technicians, everybody was so good that everybody was like, it's a God-given task given to them. So this is a time we should receive this call and do the necessary. So we created a separate fever OPD, and there people used to wear PPP and see the patients. And initially, after a week, those they were treating, they fell sick and they caught up with the COVID. Then there was again a panic. So we went through all these things. But the best part is that most of the patients we could save in all our three hospitals. Our success rate was more than 96% in all three hospitals. Maybe in Assam, maybe in Nashik, maybe in Aurangabad. And that gave us a very good fulfillment kind of thing, that we could save 96 out of 100 patients. So, but we also did that. We are an organization spreaded in community. We did a lot of awareness programs and relief package programs also. So there were a lot of destitute people. There were a lot of hawkers who were jobless, and there were a lot of beggars who were not getting even food for their daily. So we did a lot of other projects which helped society in different manner. We went into rural area, provided awareness and know-how. And very interesting thing is that as we are working in the slum, we started a what we say, kitchen for poor people, beggars and destitute people in slums. And now we are still continue with that. We are giving food for 300 destitute people every day, 3 times in a day. So that was started in COVID time. So in a way, it was a nightmare which is past, but in a way, it was a very big learning for us, that how to look at the life, how to look at the patient in a way. Psychological trauma was a big thing in COVID. People were panicking. And one interesting procedure or a process our doctors have started was, as we were not allowing any relative to meet any COVID positive patient, every day 1 o'clock we used to sit with all the relatives. There used to be a conference in a conference hall, and all the treating doctors used to sit in front, and every patient's relative used to get updated about his patient status. So the patients are also made, relatives are also made stress free.
Yes.
Because for 8 days they couldn't see their mother or father or brother. But every day they used to get a feedback. Name by name, we used to call 150 patients that your XYZ patient, I have seen him. He is better. Now he has taken food today. All medicines are given. He has no fever. So relatives used to get very comfortable. So this way we did a lot of good things, and many people have done heroic things in the country and outside country also. So hats off to the people power, and we are fortunate to have such an opportunity to contribute.
First of all, sir, I must say that it is my great honor to be having a conversation with you, who has worked for the public, and your team has been doing great. So I'm really happy that I did this interview and you accepted our appeal. So thank you so much, sir. It was indeed a
I'm
great
so glad.
conversation which I had, and I think there could have been no better way to bring an end to this conversation, because at the end there was positivity. So thank you so much, sir, for giving us your time. I hope you have a great day ahead.
Thank you. Thank you very much for giving us opportunity. Thank you.